to show you what umbilical cord blood is like. This is from the Duke University trial, and this is just freely available on YouTube. This is, in the orange here is Professor Joanne Kurtzberg, who is a world-leading hematologist and has done a number of umbilical cord blood studies. And you can see it's just a standard IV bag line. And this boy who has cerebral palsy is having an IV infusion. You can just see it's a standard procedure. He's also got other standard procedures going on, which is a television and a video, so it doesn't feel so stressful. But this whole procedure goes on. It takes about 15 minutes. So it's really, you can see why we can say it's safe to obtain umbilical cord blood, and it's easy to use as well. It's very low risk treatment for people. They're quite a long way through their study there at Duke, and they've treated several hundred patients now. So this is what would happen though if you wanted to use neural stem cells, and this is some footage from a stem cell tourism video that SBS aired. But you can see that it's a neurosurgical procedure, and this is complex because these cells are the most likely to work, but you have to actually have a very skilled surgeon capable of implanting them directly at the injury. Don't worry, the garments are up, you won't have to see the whole procedure. But you can see they've actually, this is called a stereotactic placement of cells, so they've actually got to place the cells carefully. So neurosurgeons are of course very brave people, and they tell you this is a very simple procedure for them. It doesn't feel simple to the rest of us, but that's what it takes to get neural stem cells where they need to go. Scientists have tried every other route, so in through intravenous line, in through the nose, into the cavities that naturally exist in the brain for fluid circulation, and they just don't travel, these cells. They have to be placed. So those cells and studies will come, but they require enormous care and safety and concern for children and for people with disabilities who earn and deserve our respect with their safety and their quality of life. So just thinking though as well, for those of you in the room that are health professionals, I wanted to sort of signal that this would not be a foreign concept to you in medicine and rehabilitation, that there are many scenarios where medicine and rehabilitation work very, very closely together. So a good one we know about in cerebral palsy, for example, is botulinum toxin. If you put botulinum toxin into muscles that are overactive to reduce that overactivity, you get a benefit. If you use rehabilitation alone, you get a benefit. But if you use the two together, you get an even bigger gain, because one improves the paradigm of the muscles for working, the other trains the muscles to work. So if you put those two compatible interventions together, the person gets a better result. Now, we think the same thing is going to happen with stem cell intervention, that there's going to be a huge role for rehabilitation, that you could imagine, particularly if you have an established injury, brain injury or cerebral palsy, or maybe you're an adult with autism, that you've been set up a life for yourself that where you do things a certain way. All of us have habits, but just like the brain has certain ways of moving, and it's optimized with the brain injury that exists or the brain abnormality, it does the best it can with what's available to it. So you could put new cells in there and they could grow, but if you do not use or execute from those cells, you will not function any differently. So your brain could look different, but your function might not be different. So we think there's going to be a very strong way forward for a partnership between rehabilitation and neuroscience to actually drive the two of these working together. So we do know that training-based rehabilitation, where it matches the person's goal, it's intense, it's task-specific, it's repeated, induces neuroplasticity, and it tends to drive new cortical connections. So what we want to do with stem cells is provide that type of training rehabilitation that drives these cells to grow the new kinds of nerves, axons and pathways that relate to the kinds of functional activities that the person wants to do. So if you're a rehab person, I think this is not just medical science, this is actually going to be a new frontier in rehabilitation as well.